Are you waiting or are you actually creating? Are you waiting for someone to give you the gift of health and vitality, which we know is the most precious thing that is available to us today? Or are you consciously creating it? In this video, I go into a concept of time which will give you a deeper insight on what allows individuals to create a conscious future that they are seeking. Hi, my name is Dr. Arun Dhir. I'm a gastrointestinal and a weight loss surgeon, and I've practiced my craft over 2.5 decades. One of the questions that I have often been intrigued with and that has always sparked my curiosity is that why do patients, when they come to seek medical practitioners with the same problem, they are seeking the same medical practitioner and they are going through the same treatment, but they get different outcomes? The question around difference in outcomes, and especially when it comes to surgery, is so pertinent because outcomes are ultimately what are determining our quality of life. And when it comes to surgery, this is serious game. On one end of the surgical outcomes, we get individuals who recover completely and they are enjoying amazing health and vitality. Whereas on the other end of the spectrum, there are individuals who are no longer with us. Despite all our intentions, the medical team's efforts and the prayers and everything, we lost that individual. Now that is the worst case scenario. See, the presence of health and vitality is a gift that is priceless. And the bigger question is that are we waiting, or are you specifically waiting for someone to give it to you in a platter? Or are you consciously creating it for yourself? As I said to you, I've seen patients over decades, right from my days when I started med school, and I started noticing these differences. Same patients, same procedures, same problems, same treating team, and one goes home feeling happy and gratitude for full recovery, and the other is taken out on a stretcher. See, this is how I've come to understand that we live in two worlds simultaneously. We have an inner world and we have an outer world. And I think that is what plays a huge role in determining our outcomes. I'll give you the example of these two patients who I was fortunate enough to provide a service for, but two different outcomes. I had this gentleman, Thomas, who was in his mid-60s, and both these patients that I'm going to tell you about were diagnosed with the same condition. He was diagnosed with an esophageal cancer, a pretty nasty disease because it has got poor outcomes and it creates a lot of debilitation because people are not able to swallow and they're vomiting all the time. And Thomas underwent the treatment, chemotherapy, and then went on to have surgery. But when I met Thomas, I got this impression that he was an angry man. He was going through some legal battles. He was going through some issues in his personal life. And all of that was filling him up with a lot of resentment. He was just an angry man who was not happy with life. At the same time, I was referred Dorothy, who was in her late 60s, and she had esophageal cancer as well. Now, one meeting with this lady would tell you that she had love for life. She was recovering from breast cancer and had just completed her chemotherapy, and within 6 months, she got this new diagnosis of esophageal cancer. Pretty traumatic, isn't it? Like you've just recovered from one cancer and you're hoping that you have kind of, beaten it, as we love to call it, and you are given another cancer. Now, she underwent surgery and she underwent, of course, the chemotherapy and all of that. And she was always smiling. I cannot forget Dorothy. Every time she would come into the hospital or to come and see me in my office, she would just give me a hug. She had beautiful attitude and beautiful aura about herself. 12 months down the track, we sadly lost Thomas to recurrence of the cancer. The disease came back in a nasty form and spread everywhere. Whereas Dorothy still is under my follow-up, and she comes with an extreme sense of gratitude and appreciation for life. So what is the take-home message? I think the message is that time is all that we have given to us. Whether we are wasting that time waiting for somebody else to give it to us in a platter of what we are seeking, or are we actually consciously creating it? See, one of my mentors showed me this beautiful example of this sand timer. He said that in this sand timer, if you see the part above, that is the amount of sand that is left in the upper portion, is your future. We don't know how much sand is left for every one of us. Whereas in the bottom half, whatever sand is trickling down is the past. This is already gone. Now, the sand that is trickling is the time that is ticking. Now, whether you choose to focus on the past and live that way, with giving energy to all the negative emotions or all the events that have happened in your life, or do you choose to focus on how much you have got left, and which we don't know? The best way how I could summarize this for you is by this beautiful poem by Dr. Benjamin Mays. It is called I Have Only Just a Minute. And this is my take on it, on how we get the motivation to use the time that we have been given on this beautiful life journey. This is how it goes. I have only just a minute, only 60 seconds in it. Forced upon me, can't refuse it. Didn't seek it, didn't choose it, but it's up to me to use it. I must suffer if I lose it, give account if I abuse it. Just a tiny little minute, but eternity is in it. I hope you like this video. Do share it with your family and friends, and do remember, eternity is in every minute. Take care and stay blessed.